I am Dr. Venkataram Mysore, Dermatologist, Dermatopathologist, hair transplant surgeon and Director at Venkat Center for Skin, ENT and Plastic Surgery, Vijayanagar, Banashankari, Cunningham Road, Bengaluru. Are lasers useful for menopausal symptoms? Yes, they are. Now, what are the menopausal symptoms? Around menopausal age, 45, 48, 50, whatever, a woman develops certain symptoms. Pigmentation, extra hair growth on the face, wrinkles, sagging of skin, accumulation of fat, and sometimes they may develop internal intimate symptoms such as stress incontinence, etc. Some women may also develop snoring. All these symptoms can be addressed by laser. Let us look at them each one by one. Pigmentation is extremely common. Melasma, photopigmentation, maturation pigmentation. They can be treated by two types of lasers. One is nanosecond laser or Q-switch NdYag laser, and another one which is more recent, which is picosecond laser. These are very safe lasers. Procedure is very simple. 4 to 6 sessions may be needed from case to case, and the improvement is generally 70 to 80% or even 90%. Complications are hardly any, one of the safest procedures. Some women may grow hair, so hair removal can very effectively be done by lasers. The lasers include diode laser, NdYag laser, alexandrite laser, and more recently what are called multi-wavelength lasers, wherein you have more than one laser in one machine. These are extremely safe. The technology is well established for over 20 years. And generally they take between 4 to 8 sessions. Complications are extremely rare. This is one technology which is established by itself. One caution, however, grey hairs cannot be removed by laser. The hairs have to be black. Now, the next symptom is the aging changes such as fine wrinkles, sagging skin. These can be very well effectively addressed by lasers. The lasers include fractional lasers, Erbium YAG or carbon dioxide lasers. Some types of NdYag laser called pigmentation lasers, which we have already mentioned, and tightening lasers such as NdYag lasers or another type of machine called radio frequency, which tightens the skin and prevents sagging. So these are the lasers for the aging skin. Then some women develop intimate or what we call feminine symptoms, laxity of the vaginal wall leading to sexual dissatisfaction, or much later stress incontinence, etc. And in this new exciting field, lasers can be useful for feminine rejuvenation also. NdYag laser is eminently suitable for this. Carbon dioxide laser, Erbium YAG lasers are also used, and recently radio frequency devices are also used. Snoring is one more indication, not specifically for menopause, but any woman, any man. Erbium YAG laser is useful for snoring also. Some women put on weight, double chin, putting on weight around the waist. Laser lipolysis, either a diode laser or the NdYag laser, can be used. So, as you can see, the different symptoms that occur in a menopausal woman can be addressed by different types of lasers. In some situations, multiple lasers can be used for one patient also. For example, 3D rejuvenation or 4D rejuvenation, wherein we address aging of multiple layers of skin through different types of lasers. So we can use nanosecond laser, fractional laser, an NdYag laser. All these can be used together to address aging at different stages. Likewise, if any woman has scars, pimple scars, pending old scars, they can be addressed through carbon dioxide laser or Erbium YAG laser. Stretch marks are pretty common and they can be addressed through a fractional laser also. So what is needed is an intelligent use of different types of lasers depending on the indication, depending on the requirement of a patient, and in some occasions we have to combine these modalities with other types of treatments such as botulinum toxin or fillers or a fat transfer. So ultimately it is possible to give excellent results to all the menopausal symptoms very safely with minimum downtime. Most of these procedures do not require a woman to sit at home or take leave. There is no healing time and gradually they become better. But one word of caution, with advancing age, changes can recur and so patients will need repetitive treatments once in 6 months, once in a year, once in 18 months, etc. So do not be afraid of lasers. The current lasers have been time tested, they are extremely safe, and in the hands of an expert dermatologist with good knowledge of lasers, you can get excellent results.